Hi, and welcome to the TB Digital Quilt Community Connect booth. My name is Wingxi, and I am a project manager at the Open Source Pharma Foundation, a nonprofit based in Bangalore, India, aiming to develop new affordable drugs in areas of great health need, and by doing so through open source principles. And through collaboration, we are working with various partners to develop vaccines and drugs, such as for tuberculosis and COVID-19. We also have initiatives that focus on education and awareness, such as the TB Digital Quilt. And today I'm going to tell you a bit more about this project, as well as how you can contribute by stitching your own video to the quilt online. The TB Digital Quilt is a joint project of the OSPF and Mayo Clinic Center for Tuberculosis. This digital quilt consists of videos contributed by people all around the world sharing their thoughts and experiences concerning tuberculosis. So either as a patient, survivor, doctor, researcher, family member, advocacy group, concerned citizen, anyone can share their TB story here with the world. And these video contributions are displayed in the form of a quilt, as you can see here. The aim of this initiative is to raise awareness about TB and bring together the global community in support of those affected by the disease. With many voices, many stories, and by putting a face to the issue of tuberculosis, we hope to empower those affected, to encourage greater funding opportunities for research, as well as to promote global collaboration. So why a quilt? The TB Digital Quilt was inspired by the AIDS Memorial Quilt that was initiated by the NAMES Project Foundation. The AIDS Memorial Quilt officially began in 1987 and is an enormous physical quilt consisting of individual quilt panels created and stitched by the loved ones of those who lost their lives to AIDS-related causes as a way to remember and to celebrate their lives. And it aimed to shed light on the AIDS pandemic and the need to fight the stigma associated with it. And here you can see two images of the quilt in Washington, D.C., where it was first displayed. This quilt consists of 48,000 panels and represents over 94,000 individuals. It has had a strong influence on funding for AIDS prevention and education, and it continues to build political will across the US and the world today. Celebrities and politicians are amongst the many who have contributed patches and have spoken about the quilt, including the Clintons who attended the opening display. And so the response to the quilt's inaugural display was overwhelming, and it led to a 4-month, 20-city national tour for the quilt in 1988. And this nearly raised $500,000 for AIDS service organizations. And the contributions, as you can see here, were not just from the US, but from all around the world. And even today, you can see the quilt panels online through an interactive website, and people continue to support the cause. And the quilt is currently displayed in San Francisco. The TB Digital Quilt is a version of the AIDS quilt for the digital age, allowing people from all around the world to simply contribute through their computers or phones, and also to view and share the videos through social media, which we know today is a very powerful tool. Similarly to the AIDS quilt, we expect to see greater awareness of the impact that tuberculosis has across the world and emphasize the need to come together to fight the disease through funding and research. We also anticipate to encourage greater collaboration across sectors. And with greater collaboration, funding, and research, we believe that the elimination of TB can become a realistic goal. What is also important about a global campaign like this is that it does not only include or reach people who are already involved in the fight against TB, but also those who are not familiar with the disease. So unlike what we are seeing with a global pandemic like COVID-19, information about TB does not spread as quickly. It is not a major concern for all regions around the world. And what we saw with the AIDS quilt is that uniting people on a greater level can really shed light to an issue beyond those who are directly affected. So here are a few examples of videos collected on the quilt, including from last year's Community Connect booth in Hyderabad, India. So you can have a listen to their stories here.
Hi, my name is Jake Wintermute, and I'm interested in frugal drug screening technologies. What I want to do is take the power to discover new drugs against tuberculosis and democratize it, move it outside of the places where it's traditionally found into classrooms, into biohacker spaces, and into communities that are actually being affected by tuberculosis.
Hello, my name's Pearl. Thank you for allowing me to be part of this TB quilt in raising awareness. It's just so important. I contracted TB back in 2017, and it just came out of the blue. I had no risk factors. I lead what I call a normal life. I just go to work. I live in England, in Devon, a quiet place where you wouldn't expect it to be. Symptoms aren't really known. GPs struggle. So for me to help raise awareness in any way I can is only a good thing. I had to take the minimum of medication, and that included 840 pills. They're quite toxic. They can cause liver damage, eye damage, nerve damage. However, they did save my life, and I'm very grateful for that, which is why I'm very pleased to be part of this today. TB is something that doesn't leave you easily. It can maim you for life. It can cause psychological damage. You get anxiety about leaving the house and seeing people coughing around you. But anyway, what I want to say today to everybody is that shadows should be enjoyed by the sun and not hated in our lung. Thank you.
Hi, my name is Siraj, and I'm glad to be at the conference. And I'd like to say that it's time for a better approach to address TB around the world, especially when we're talking about the stronger community participation. So I hope all the policymakers and all other stakeholders would take this into account in their works. Thank you.
திங்க் இதை பற்றி பேசுகிறதுக்கு என்னை விட பொருத்தமான ஆள் வேறு யாருமே இல்லைன்னு சொல்லலாம். ஒரு 10 வயசுக்கு முன்னாடி, பிஃபோர் ஐ வாஸ் 10, yes, I had TB. I was treated for primary complex, and before I turned 40, I again had TB and I was treated. Look at me now. I'm doing my morning exercise. I stopped my jogging and I'm giving you this small bite. TB is nothing dangerous, but it's something that we need to look at, and 8 months of treatment will sort it out. I think TB மேல இருக்கிற அந்த taboo வந்து we have to take it off. It is contagious, yes, but கரெக்டான ட்ரீட்மெண்ட் கொடுத்தாங்கன்னா, இப்போ நம்ம கவர்மெண்ட்ல and these kind of NGOs, the kind of awareness that is created by them will really sort it out, because I am somebody.
So there you can see a few examples of videos contributed from all around the world and also from different perspectives. So from survivors, from researchers, and mainly talking about why they are concerned about TB and why they want to join the fight. If you'd like to learn more about our mission and partners, we invite you to visit our site, and we're always looking for partners and funders to continue growing this project. So if you or your organization would like to take part in any way, please feel free to reach us through our site. And here's a quick look at our current site. We have information about what TB is and how far-reaching it is in terms of the number of people infected with the bacteria. We also share a few quick facts for those who are not familiar with TB, because as mentioned, we would also like to bring people who are not involved with the cause into this movement. And we also have more information about our mission to help end TB, and also information about our partners and supporters, including TB Alliance and Louder Than TB. On the homepage is where you can view the videos and search by category. So here we have gender, age group, who is contributing, so for instance, patient, survivor, or doctor, and which country the video is coming from. So we have videos from Colombia, Ghana, Hong Kong, India, the US, and a few from Europe. And we'd like to keep this growing as we reach out through conferences, social media, and our partners. So right now, for the last 15 minutes of this session, we'd like to encourage everyone to get their phones out and submit a video, even if it's as short as, "Hello, I'm a researcher, and I support the fight against TB," because here every story counts. That is a link to our website, and all you have to do is follow a few simple steps. 1, visit www.tbdigitalquilt.org. Step 2, click the menu button at the top right and select Share Your Story. Step 3, add the information requested, such as your name and country. Step 4, click the Choose File button and select the camera option. And here you can directly take and upload a selfie video on your phone. Then you click Submit and see your video stitched onto the quilts. And please wait until you receive a message on the screen that says you've successfully uploaded your video before exiting the page. And that's all. So this will only take a few minutes, and we look forward to hearing stories from you. Thanks so much for your time, and thank you also to the Union World Conference for this opportunity to share about the TB Digital Quilt.